your hands. Just like washing your hands. Okay, how do you say for 20 seconds at least?
Well,
20 seconds. Okay. Continue.
Do I need to, like, I feel like I'm really short back here. Do I look really short back here? I am kind of short. So.
not too short.
It's okay.
Let's go with this. I'm probably short.
Okay.
There you go.
Waiting just a couple minutes to hit the 3 o'clock hour in case somebody comes sliding in at the end at the last second. Sure. So first of all, thanks everybody for taking time to be here today to hear more about this really important issue facing our community. I want to thank Mayor Jacobs and Mayor Kincannon for their support of all the efforts that we're doing in our community and here at the Health Department, and of course my healthcare partners and our East Regional partner for being here to support what we're doing to help limit disease and people who pass away from COVID-19 in our community. And there are many, many things going on right now. And so I just want to kind of give you an update on where we are. As you know, we continue to test and screen daily. Our staff and their staffs are screening many, many people who are concerned about whether they have COVID-19. And we are able, between all the efforts that we're all doing, to get people access to testing who qualify. So not everybody who asked to be tested for COVID-19 needs to be tested for COVID-19 at this time. So it's a limited list of folks who get tested. They have to have symptoms and other risk factors in order to be tested through the health department. Hospitals use similar criteria in judging who is able to be tested based on what they see, the clinical picture that the doctor sees in front of them. And everybody's standing up testing in different ways. And when we say standing up, that means they're making it available. So everybody's making it available in different ways. So there's no one answer for how we increase access to testing. There are multiple ways we're trying to do that and working to get the supplies that are needed, the testing supplies, the personal protective equipment, and all those things that we need to do testing. At this time, we still continue to be at 1 case in Knox County. As I've said before, I expect that to change, and it changes, when we have a positive test that comes through. As you know, the state updates their website at 3 o'clock every day. We have also partially activated what's called our Emergency Operations Center, and we've activated that because there's some social needs that have to be considered if we happen to close schools. If something happens in the homeless shelter, if they get a case in the homeless shelter, how are we going to manage those things? So we have a partial activation of our Emergency Operations Center to help coordinate those things. We will be sending requests up to that as well. Our community partners will be sending requests up to the Emergency Operations Center to coordinate with nonprofits and other folks to help meet those needs. So that's a really great activation to help support those who might have some needs that we, public health, can't meet and that the community needs to help us meet. One of the things we're trying to do with social distancing is to decrease the number of people who get exposed and decrease the number of people who get sick. And what we call that is flattening the curve. So what we hope to do by doing that, encouraging people to stay home if they're sick, encouraging people to wash their hands, encouraging people to not gather in large groups, is to decrease the risk that people get sick. And we're not trying to stop the people from getting COVID-19 totally. It's going to happen. We're just trying to slow it down. So instead of doing this and having a big giant peak that will stress our system, our economic system, our medical system to the max, we're hoping to blunt that curve. So it just a little more slowly goes up. Maybe it stays up a little bit longer but doesn't go as high and then goes back down. That's much more tolerable. That's much more like what we kind of see with flu season, much more tolerable for our medical system and for our economy as well. So number one, all of these people up here, we're all focused on decreasing people getting sick and decreasing people dying from COVID-19. That's what we focus on every day. And what the other parts of the economy and those things we want, obviously are not our primary focus, but we are aware that COVID-19 is going to impact our economy. And so we're thoughtful when we're talking about when do we close things, when do we not close things, in consultation with our leadership, very thoughtful about those things and doing the best we can to protect our community. One of the other things that we've done, because we know seniors are at highest risk for complications to this illness, Mayor Jacobs and Mayor Kincannon made the decision to close senior centers across the city and the county today. Unfortunately for those folks who would go there normally, we were asking them to stay home. And I think another thing, when we talk about social distancing and closing things, it actually only works if people actually go home. It doesn't work if people go gather at the jumpy gym or wherever they gather. It only works if people actually go home and actually practice social distancing. When we close the senior centers, we're asking those folks to go home and limit their exposures. And honestly, we're asking older folks to really be thoughtful about their exposures and limit those exposures. And some of those things are happening automatically because we know churches are moving to more online venues. And we're asking, mass gatherings to either cancel or postpone or do something virtual. Again, all about social distancing, all about decreasing the burden of this illness in our community. And we continue to monitor the situation closely, as do our partners here in medical care. And so I'm really grateful for the partnership we have with our medical care community here. These guys are fierce competitors most of the time. But they come together for our community, and I've seen this happen over and over. I've been here for 15, 16 years, and I've seen this happen with H1N1, with the flu shot shortage. We come together, we share supplies, we share ideas, and we move forward together to protect our community and speaking in one voice. And today, it's all about letting our community know that we are working very closely together and very hard to reduce the risk to our community and do everything we can to protect people from getting ill and find those folks who are ill, who have COVID-19, and then public health does our part to isolate them so that they don't make other people sick. So testing is important, and we want to increase access to testing. But testing doesn't change the clinical care or those other things that have to happen. What it does change for us in public health is that we know who the people are who are sick, and we can isolate them in the least restrictive way possible. We do this all the time with other patients, with TB patients. And in here, we'll be isolating people at home if that's their choice. Don't see us setting up isolation centers. So I think we're doing a lot of work on our end to decrease illness. And now we also need the community to help us decrease illness by, being thoughtful about the things you do. A really important thing all of us can do is stay home when we're sick and not share illness with others. And reduce, handshaking, reduce touching our eyes and nose, covering our cough. And when we think about employers looking at their leave policies so that people can stay home if they're sick and not have to worry about losing their wages or not getting paid. Those are important things to do to encourage folks to protect their coworkers in the community. And so it's just really critical that all of us pull together, and the more we can do individually to reduce our risk, we're going to protect our community, and we're going to slow the growth, the rate of illness in our community, and really enable us to survive this and come out on the other end stronger and hopefully not have so much economic impact and so much impact on our medical folks. So right now is not the time to panic. Right now is the time to be thoughtful. And I believe we are being thoughtful under the guidance of our political leadership and our medical leadership, being thoughtful about the decisions that we're making. Some decisions are being made at the state level, and we know that. And we're following those guidelines, and we're following CDC guidelines. So we're in lockstep with the state of Tennessee, and we're lockstep with the CDC in the guidelines that they're putting out there. So really, I just want to remind everybody that now's not the time to panic. It's not the time for fear. It's the time to be thoughtful about what you do and how you do it, and to be thoughtful as employers, as citizens, as healthcare providers, and as leaders in our community about how we do the right thing to protect our community. And so I think excuse me. Oh, yes. Before I turn it over to questions, I really would be remiss if I did not acknowledge my staff who is working 7 days a week, not 24/7, but 7 days a week. I know these guys are too, to field questions, to answer questions, to get people the testing they need, to help people understand what's going on. And I really appreciate all the work they're putting in. And we're pulling in staff from all departments across the health department, and probably will mobilize some of the county departments as well as this thing continues to grow. But I'm really appreciative of my staff and the support they provide and the passion they have to protect our community. And now, any questions? Yes.
Danny, can you talk about whether or not the county will be opening up? It sounds like it will be opening up some mobile testing sites and early plans for that.
Well, I do know there are discussions happening about whether it's even feasible to open mobile testing sites. And so we're looking at that and talking about that. As you can imagine, there are a lot of logistics to figure out. And one of the challenges we have with testing, honestly, is that having adequate supplies to collect the specimens and having adequate supplies to put the testing stuff that you ship it to the lab in, and protective clothing for our staff. So we're working together to secure more of those supplies in hopes that we can expand testing and possibly have a drive-through testing site.
I wanted to ask, if I could, about community transmission, which you've said is expected. How would you recognize that? How do you begin to recognize that something like that is going on? I believe it's already happening in Davidson County,
Sure.
not here yet.
Sure.
How do you know that that's going on?
So that's a great question. And using epidemiology and what we know about disease, when we have somebody, like if I were to get COVID-19, it would be community acquired. I haven't traveled. I haven't been to a place where it's actively being transmitted. It would be community acquired. So somebody who doesn't have any of those exposures, somebody who's not cared for someone with COVID-19, somebody who hasn't traveled to a place where active transmission is happening, or maybe a healthcare worker, is not a healthcare worker who care for somebody. But so if somebody who lives here and hasn't been exposed gets it, then we know they got it here. So we know we have community transmission at that point.
So there's no numerical standard or anything like that. It has to cross a certain boundary.
There's really not. It's really when we see that case that is homegrown, that they got it here somehow.
And no idea, presumably, of a timeline for that.
We
right?
don't have an idea
Could
of a
be
timeline
tomorrow,
for that.
Could be 3 weeks from now. We just don't know.
Sure could be.
Are there enough tests? I mean, I know that there's been discussion at the national level about limitations on testing. And you say there's enough tests for people who meet these criteria. If there are more tests available, will those criteria lessen so that more people could potentially get tested?
Well, honestly, we don't want to test everybody because testing everybody really has some challenges with it. One, you can have false positives. So if somebody gets told they have a disease they don't have, you really want to use the clinical judgment and clinical picture of that patient to decide if you test them. And that's what clinicians do every day. They decide based on who you are and what your symptoms are, what tests should be done for you. And we want them to continue to do that. And general screening of everybody can be fraught with challenges.
But, for example, with the flu test, you can go in and get a flu test pretty easily. You have one or two
But
symptoms.
you have symptoms, yeah.
Right, but I mean, my understanding, correct me if I'm wrong, but there are people being turned away who are requesting tests because they don't meet that specific set of. Basically, if you get more tests, are those criteria going to change so that more people can be tested?
It's a great. So there are two different avenues for testing right now. Testing through the Tennessee Department of Health, which is what we do, and those criteria are limited because the Tennessee Department of Health is focusing their limited resources on highest risk folks who are more likely to have the illness. And then there's community testing, and I can't speak for what guidelines they're using, where they're sending it to Quest or LabCorp or any one of the commercial labs that are available. And I believe we did decide that you need fever and cough. So in an outpatient setting in one of these facilities, someone who presents with that clinical picture and it seems appropriate to test them, the doctor would consider testing. Oh, yeah, does anybody else want to, yes, thanks, answer that?
Well, I think I would just add, Martha, that the absence of other findings is the other key piece there.
Right, like a negative flu.
Yes. So, I'm Dr. Childs. I'm the Chief Medical Officer at East Tennessee Children's. Our criteria for testing is focused on exactly what Martha shared. If they have fever, cough, or an illness that we can't identify another source for, then we want to test those individuals. We also look at their risk factors such as travel or exposure to other people that are under investigation for this disease. But it's kind of common sense criteria that is fed to us with good forethought by the Department of Health and the CDC.
Other questions?
How many tests do you have currently available?
I actually don't have a number in my head. I think it varies, and we're all looking to get more supplies. So when we think about testing, there's the swab to collect the specimen, and then there's the medium to put it in to send it to the lab where they test it. So there are several different supplies, and then there's the personal protective equipment that you have to wear when you obtain the test. So all of us have supplies. We're all looking to get more of those supplies, looking at all of our supply chains, and questioning whether we'll get supplies from the federal government or the Tennessee Department of Health. So looking at all the possible resources where we could get supplies to get those supplies here in our community.
Do we know how many have been tested so far? Do we have any numbers on?
We don't, mostly because we're not doing all the testing. Everybody's doing testing. So keeping track of that number when it's being done across the community is a challenge. So we know that many people are being tested, and few people so far have been positive.
Ken, we're fortunate to live in Knox County with the plethora of medical providers you have here in the room. Can you talk about what, if anything, you're doing for the surrounding counties that don't have medical providers or have very limited options for the medical providers? Are they inundating Knox County with those requests, or are you helping sift that through the other counties?
Well, we have our regional office here, and she can speak to the efforts that are happening outside Knox County. Dr. Tara Sturdivant.
Hi, good afternoon, and thank you for that question. Testing is going on out in the region. People with appropriate symptoms and travel history are being tested. They're being tested at our county health departments if they meet the criteria for public health testing. They're also being tested at our regional hospitals, and there is availability of commercial testing in the communities. Does that answer your question?
So for those communities that have very limited access to hospitals or no hospital at all, you'd say that go to your health department would be the best place to go, or just tell me.
No, I mean, there are outpatient clinics across the region that have availability of testing. So if you don't meet the criteria for public health testing, they should go to one of the outpatient clinics.
But call
Really,
first.
yeah, it's good to call first, because we don't, we don't want to expose medical staff. I mean, we would prefer that people be able to mask, while they're in the parking lot. They're met by appropriately protected healthcare staff, so they get masked in the parking lot before the specimen is collected. But I don't really see, we've not experienced personally, and we've been doing a fair amount of testing, frankly, so I'm not experiencing that there's a challenge to getting people tested just because they're out in the region. We would rather people be tested in the region rather than driving to Knox County. All of our county health departments, we have 15 county health departments, they all have the capacity. They've got plenty of testing supplies, both viral media and the appropriate swabs. They've been trained. They've got plenty of PPE. So if somebody meets the appropriate criteria, they can be tested at the health department. And we have identified their outpatient clinics in which they can be tested if it's appropriate, if they need to be tested. And then there are regional hospitals that can test if someone has symptoms that are severe enough to need to be evaluated in an emergency department. Does that address your question? All right, thank you.
I'll make a comment, Mark. Sure. I'm Dr. Mark Brown. I'm the Chief Medical Officer with Covenant. Just to reiterate kind of the sidebar comment, if you have symptoms, please call first. Call your primary care provider. Before you come to the emergency room, please call. Many patients who are experiencing symptoms will not need to physically go to their provider. And many providers are setting up alternative ways to be able to communicate with patients either by phone or by FaceTime or all those things. And we're all very actively working through those solutions, and they're changing day to day. But the first thing to remember is call your provider first and let them give you guidance as to where to go for testing and the type of testing you might need. Because whether it's the health department or our primary care offices or our urgent cares or our emergency rooms, certainly, we don't want people showing up unannounced so that it's in a less controlled situation if they were to have a high-risk travel history or high-risk exposure history or symptoms.
Yeah, I'd like to make a comment.
Sure.
My name is James Shamia, Dr. James Shamia. I'm the Chief Quality Officer at University of Tennessee Medical Center. And one other point about this is sometimes it's the unintended consequences of things like this that you lose sight of, and other illnesses still occur. It's not that we now are only focused on COVID-19, and my point in that is blood donation is still very important. So as a community, particularly if that's something you've consistently done, we need to make sure that we don't lose sight of those other things that can happen. And so the need for blood hasn't changed because of COVID-19. So I just want the community to understand that, whether it be going to donate blood or if blood drives. Obviously those have to still be cognizant of social distancing and things like that, like we are everywhere else, but it's still very important.
Thank you.
Thank you.
Based on how the virus is spreading in other communities, both here and abroad, and the numbers that I'm sure you're projecting, are there enough hospital beds in Knox County for the anticipated number of patients? B, are there enough ICU beds in particular? And C, what, if anything, are the hospitals doing to free up beds, measures such as canceling elective surgery, that sort of thing?
Could you please repeat the question into the microphones?
That was a long question. Sure. I'll do my best. So first question was about how many people do we anticipate getting sick? How many of those people are going to have to be in the hospital? And how many of those people might need an ICU? And are there enough beds? And what's being done to free up space in hospitals to create capacity? So first of all, part of what we don't know is how many people will get sick. And again, I'd go back to trying to blunt that curve and reduce that peak, that spike, the spike of cases. So all the things we're talking about now, social distancing, staying home if you're sick, avoiding people who are sick, covering your cough, avoiding touching your eyes and nose and stuff like that. Those are all to reduce illness in our community and keep us from having that big spike and having a slower growth of illness, which is much easier for our system to tolerate. So I will let them speak to specifics, but we are all talking about how do we everybody has a surge plan, and we're all talking about how we put that into place together and in concert with each other, like we're doing the other things that we're doing, like ramping up testing. When will we do that, and how do we make those decisions? So we're talking about that as we watch the number of cases go up. Right now it hasn't gone up in Knox County. It's gone up in the region a little bit, but I'll let either one of the hospitals, any one of the hospitals speak to that.
Thank you, Martha. As you probably all are aware, the guidelines and the changes to the guidelines from the state and federal governments are coming fast and furious. And we are following all the state and local guidelines and recommendations, along with reviewing all recommendations from national professional societies and making sure that we're being consistent with those. One of the most important things we're doing, and doing this again as a community across the region, particularly in the acute care facilities, is really limiting visitation. I'm sure you've seen at all of our hospitals or on social media the different signage around limiting visitation, and I think you can anticipate that, as we've seen in other communities, that those restrictions on visitation may increase. As far as making sure we have the ability to care for people, one of the most important things for us to be able to care for people is taking care of our staff, taking care of our healthcare workers. So reiterating what Martha said, if you are sick, please do not come to the hospital. And again, limit that exposure to our healthcare workers, because we need to do everything we can to keep our teams healthy so that we can care for those patients. Also, across the state and across the community, we track our supplies together. So ventilators, personal protective equipment, we're entering all those into a system called the HERTZ system that we do at the state level, and that's recently been expanded so that we can track those supplies and, if necessary, share them not only locally but across the state.
So I'd like to add, just from a planning perspective, that we are meeting daily to discuss a variety of scenarios, and we would be, very happy if some of the time we're spending planning is time that necessarily we don't need to use, but we have time to plan right now. And so one of the things that we're doing is looking at tiers of systems, so that if we get some additional patients, we have plan A, and then if we get another set of additional patients, more than what we're used to, we have plan B. But the other thing to remember from the standpoint of the community's healthcare resources is some of the things that typically happen at a hospital will be slowing down in this. And so there may be staff or beds or other things that we'll have the ability to use in other ways that we don't traditionally use. And so but I think my main point in that is that these conversations are ongoing, so that we really just are deliberate to use what we need if we need it.
Thank you.
Dr. Buchanan, you all have touched on testing a lot through this press conference, but we keep getting so many calls into our newsroom about testing. I just want to make sure that I am answering all of our viewers' questions.
Sure.
What can you pass along in terms of the availability of testing here in Knox County? Those people who have questions about where to go, where do you suggest they go? If you can just kind of give us a summary of testing here in Knox County and
Sure.
help ease those
Sure.
concerns for
So
them.
for starters, if you're not sick, you don't need to be tested. So that's a basic premise. If you don't have the illness, if you're not sick, you don't need to be tested. And you should always start with your doctor and call them first, and they'll get the information about your specifics. Testing we just started testing regularly in this community this week, late last week. So it's not everywhere. So it's ramping up. It's not slowly, but ramping up and getting established in different places. So there's some variability in where it's available, but it is available. If you have questions, you can certainly call us. We can walk you through that. We can walk you through whether you should call your doctor or whether you're somebody that we bring here for testing. Again, we're testing a limited number of people, symptomatic folks who have some risk factors. But again, everyone's agreed we're testing symptomatic people who meet certain criteria. It's not a blanket. Everyone who wants a test can get a test. And that's not about supplies necessarily. That's about practicing medicine and using clinical judgment to make decisions on what's best for the patient, which is what doctors do every day, and nurses every day.
Testing,
Yes. Yes.
I'm Dr. Jeff Stevens. I'm chairman of the board of Summit Medical Group. Very good question. Summit Medical Group represents 14 counties around Knox County. We have physicians in all of those counties that expect to get phone calls. I'm going to go back to what was said earlier. Please call. Please let us know that you have symptoms. We should be able to help on the phone to determine what the best next level of care is going to be. Some of those physicians will have you come into their office for testing. Others might suggest alternative treatments depending on your symptoms. We will have facilities in the near future. We anticipate coming online where we can have people referred to places where they can get that testing as opposed to coming into the offices. One thing that I do want to touch on briefly is in this time right now of flu season, we want to continue to treat the patients that we have. We continue to have all of the chronic medical conditions that we need to treat. We will keep our offices safe. We will isolate people to the very best of our ability. I want people to feel safe coming in for their routine care. We've been doing this every year for a long time. Every year we have the flu come in. It's very similar in its presentation, and the precautions are very similar to what we're seeing right now with COVID-19. We'll continue to care for this community. So again, if you have a question, call us, and we will get you either to that doctor's office or to the nearest testing facility that is appropriate as your conditions warrant.
Thank you. Thank you.
So this may be a question more for the mayors, but I think one of the concerns out there for people who aren't sick, who aren't symptomatic, anything like that, but they don't know what to do. Do they go out? Do they cancel all their lunch dates? And in other cities, we've seen often mayors, in some cases governors, give really stringent guidelines. Like Nashville is shutting down their bars, although there's some question about the jurisdiction of that, who actually has the authority to shut down the bars. So I guess from the standpoint of the mayors, as you watch what other cities are doing, what are you taking into consideration, and kind of what guidance do you give people? Because I think there's just a lot of confusion right now.
Sure. Yeah, thank you for the question, Jesse. I don't know if it's appropriate for me. I was going to share this after the end of this. But I am going to be declaring a state of emergency in the city of Knoxville as of today, and this is in coordination with the health department and in coordination with Governor Bill Lee and President Trump. And this will allow the city to have flexibility legally and budgetarily to respond to things as needed. And we're also going to be issuing guidance to people about social distancing and staying at home, and encouraging employers to let their employees telecommute, that sort of thing. At this point in time, I'm not exercising any of the new powers that come with the emergency status, but we'll have it on the table if need be. I can read this if, I don't know. I don't want to take, I can read this after the rest of this is done too, but we're going to encourage restaurants to utilize takeout and delivery services. And this is all just, recommendations and encouragement at this point. We're not shutting anything down. We are, at the advice of the health department, we are shutting down all our senior centers effective today. They're closed down. Today's the last day. They're not going to be open tomorrow. We are also sending sort of highly recommended guidance to businesses like restaurants and bars. And the sponsors of the St. Patrick's Day pub crawl have voluntarily canceled that event. We've canceled all events on City of Knoxville property for the duration of the CDC requirements through May 10th, which is 8 weeks. So I will be happy to share more details with that, but I don't want to take up too much time because this is the medical portion, but I'll speak to that more afterwards at your convenience.
Actually, if I could
Sure.
excuse me.
Absolutely.
I think too, it's also important that we're following Mayor Dr. Buchanan's guidelines here, and as well as what she is doing. And two, we have to keep in mind, that we have to balance what we're doing with ensuring public safety, as well as people have jobs. There's a lot of things going on. This is going to be a huge hit to our economy. So while balancing the safety of folks, we also have to keep in mind what is happening to our economy. And if you start shutting things down too quickly, this might be a long process, and that means you can't open things up until later. So a lot of what we have tried to do is ensure that we can keep everything as open as long as possible, so we can keep that window where some things have to be closed, we can keep that as short as possible, and cause a minimum of disruption in everybody's lives. So, and Dr. B has done a wonderful job with all this, and she's provided us some great advice. So keep it up. Thank you.
Thank you. Any more questions? All right.
If you're under,
under
sorry. 60 and in relatively good health, this is not a death sentence. And do you have worldwide, nationwide statistics as of in the last 24 hours or in the last few hours about those under 60 who seem to be in relatively good health, who have either died or are in serious or critical condition because of the virus?
I don't have any numbers in my head or reports in the last 24 hours. What I do know is the reports that came out of China, where we have the most information about this illness, we saw that those folks under 60 were less likely to become ill, and only about 80% of people who get COVID-19 have a mild to moderate illness. And very few of those require hospitalization, and even fewer of those require ICU beds. It's when you go into the older 60 and up with chronic conditions where we see the need for hospitalization and ICU beds going up. You know, it's kind of like the flu. The flu is an illness that takes lives every year. COVID-19 is an illness that will take some lives this year, maybe in future years. So it is to be respected. It is to be, you know, it's a serious illness that all of the things we've talked about that I've said repeatedly, and everyone here has said repeatedly about infection control and washing your hands, staying home if you're sick, you know, cleaning your work surfaces, cleaning those frequently touched surfaces, you know, canceling events where people come together in crowds. Those all help reduce infection across our community, no matter what age people are. But we do know that people over 60 with chronic illnesses are definitely at higher risk. People under 60 who are relatively healthy will get sick, but they won't get as sick. But some of them will probably get very sick. I mean, that's possible as well. A lot of that's based on their health before they got sick and whether they have some chronic illnesses before they became ill.
And would you say we're still at a low risk right now?
I would say we're still at a low risk. I would say that the flu is a bigger risk for you right now still in Knox County, but given the number of cases we have and the fact that it's an isolated case. So again, that's why our partners in medicine are testing for the flu before they test for COVID-19, because if you're positive for the flu, you got the flu. You don't have COVID-19. Thank you.
I thought it was you back there for a minute.
Yeah, that's why I